name is Henry Magala, the Country Program Director for AHF, which is in full AIDS Healthcare Foundation, Uganda Cares. AHF Uganda Cares is an HIV advocacy organization that looks at HIV in the country, response in the country, and it has done quite a lot to ensure that people living with HIV get the services in terms of treatment, not only treatment, but also looking at the issue of prevention. So AHF Uganda Cares has been instrumental to reduce the HIV infection in the country. As an organization, we are operating in 73 health facilities, taking care of over 260,000 HIV clients, giving them hope to live with HIV and prevent new infection. Today, I'm here to talk about the pandemic access agreement, which is a global issue now taking place around the globe, where WHO, in response to the last pandemic of COVID-19, wants to address the gaps that were identified in terms of planning, preparing, and responding to COVID-19. So we are now looking at the agreement that WHO put across. It was first presented in May 2025, but it had gaps. Stakeholders recognized that there are gaps with what was being presented at that time. It was being presented for adoption, but in it there are gaps, and one of the gaps was the fact that developing countries that contribute significantly to development of vaccine for pandemics like COVID were left out. And therefore, stakeholders thought it important to look at the gaps that were identified. And so looking at the version that was being presented for adoption in May 2025, it was found important that some annexes should be added to that agreement. So in it, in that first version, the issue of sharing benefits was not considered because we recognize that most of these vaccine are developed using samples from developing countries, and therefore developing countries should benefit from providing the source of the data, source of the pathogenic materials from developing countries. So that has led to a negotiation to ensure that those gaps are addressed. And I'll talk about some of them. One of them is that developing countries that contribute to the samples, to the data, should have access to the vaccines that are being developed for benefit from the diagnostics, and then also the treatment that arise from the sources of pathogenic materials that are being provided by developing countries. So we are saying that the original version should be updated to consider access, developing countries to access vaccines, the diagnostics, and then treatment that arise from the samples that are provided from developing countries. So that is part of the annexes that we are thinking should be included. And actually we are saying that there must be rules that should be added to the current pandemic agreement as an annex. Then the second thing is we need to consider the sharing of the vaccines. Apart from the access that I talked about, there should also be share of the vaccine that are being produced. We should have, for example, a percentage out of the vaccine that will be produced, at least a percentage, say 20%, should accrue to developing countries where the pathogenic originate from. In addition to that, the pandemic agreement misses out critical things when we consider the capacity of developing countries to develop this vaccine. We have developed capacity as African countries, the other developing countries, to manufacture this vaccine. So the only thing that we need is the technology. So we are looking at, can the pandemic agreement in its current form include issues of another critical area that we see is missing in the current pandemic agreement, access agreement, is the fact that the users, the pharmaceutical companies, have nowhere they can be tracked, monitored, and held accountable. So we are saying that in the original version, in the annex, we should have a provision for tracking these manufacturing companies to ensure that they use the samples right, but also when they produce the vaccines can also be tracked and used where they should be used. So the second one is the mandatory share of vaccine, and the diagnostic and then the treatments that arise from the vaccines that have been produced. And here we need to ensure that a certain percentage of vaccine is accessed to developing countries where the samples are coming from. Not only that, we also look at the technology and know-how, which should also be shared with developing countries. Then also we are looking at annual contribution. If WHO comes out with a pandemic fund, there should be contribution to that fund. And then the other critical issue that we want to include in the annex is the issue of registration of pharmacies that are manufacturing these vaccines, so that they can be tracked and held accountable for the vaccines that are being produced. Then another thing, we need also to have a standard contract that should be in place, and by standard contract, there are critical areas that should be in that contract, which should be negotiated before any epidemic arises. So still the issue of registering the pharmaceutical companies is very important. Issues on how they are going to share the vaccine should be there. And then the last issue that we want to see included in the annex is the issue of ensuring that every engagement should be by contract, because there was another development that was coming in, that you could have a track of access to the pandemic system. And the second one was that countries can voluntarily provide the data, and once it is voluntary, then it affects the mandatory requirement that before data is shared, there must be an agreement to share the vaccine, treatment, and other areas. Pandemics usually come when countries are not prepared. So we are saying that in the pandemic access and benefit sharing agreement, countries should put aside money and contribute towards a pandemic that might arise in the future. And the contribution ideally should depend on the economies of countries. I think that will help to ensure that funds are available immediately to respond to the pandemics. The call is to developed countries to ensure that The issue of access is considered significantly. The last time, the developing countries like in Africa were the last on the line to receive vaccine, and that affected the population, that affected the lives, that affected the economy. So we appeal to developing countries, especially EU, not to block the proposal to have sharing of access, sharing of vaccines, diagnostics, and the medicines. And we're also saying that there must be contractual obligation that should be put in place before these pandemics begin. We are trying to discourage bilateral agreements between countries and pharmaceutical companies, because there are many things that arise from that. The negotiation parties' powers could be different, and so we are saying in this agreement there must be contractual obligation that looks at issues of the sharing of the vaccines and then access to technology. Right now, this pandemic access and benefit sharing is under negotiation at country, regional levels, and also at the global level. The opportunities for communities, the opportunities for the public to contribute to the negotiation. It's important that developing countries have access to vaccines. They have access to the treatment, to the medicine, have access to the diagnostics of these diseases. And this can only happen when we lobby to ensure that developed countries make concession, respond to the annexes that have been put forward. And the community, the public can do it through their members of parliament, through Ministry of Health, because this is a global agreement where all countries contribute to. So we expect the public, we expect government of Uganda to come out when this agreement is finally being discussed to conclusion, and this is in May 1st. On May 1st, I think that's when it will be concluded. So that's a call for everybody, knowing what pandemics can cause. We saw how it led to so many things, lockdowns and all that. So until we get that advantage position to access the vaccine, our economies, our future, even our lives can be endangered. So everybody is called upon to make contribution in terms of providing ideas, in terms of urging the members of parliament, Minister of Health, to ensure that they participate in the final conclusion of the pandemic access and benefit sharing agreement. Critical things that we will see in it is ensuring that developing countries can have access and they can have a percentage of the vaccines, and they have also the opportunity to get the technologies that have been developed in the developed countries. We look forward to transfer of technology so that our manufacturing companies that have the capacity can now begin to manufacture these vaccines, and once that one happens, then they can be accessed at a modest cost. Thank you so much for watching. We are looking at a very critical issue of ensuring that our countries, developing countries, can access vaccines, and in the current agreement that we have is not fair. There is no equity. So we are trying to put a case that we need to have a version of the agreement that works for developing countries like Uganda. We need to have access to the vaccines. We need to ensure that a certain percentage of the vaccine is given to us, because the samples of the dangerous diseases that developed countries use to develop a vaccine come from our developing countries. So we have a significant contribution to the vaccines, and therefore we deserve better, because the last time when the pandemic came, COVID, we are on the last line to benefit from the vaccine, from the treatment of COVID-19. So thank you so much. We need to put our voice together. We need to ensure that the Minister of Health, members of Parliament, argue this case of vaccine access, argue the case of technological transfer, so that we can begin to manufacture the vaccine for pandemics in the country. I think the best thing is being prepared, and we can only prepare if we look at issue of developing the capacity in manufacturing this vaccine, which we have. But also important, we need to make a contribution to pandemic fund, because once we don't have funds readily available, when the pandemics strike, we are affected, especially as developing countries. We need to have reserve funds. We need to have a fund which is available to be able to be used when there are incidences of pandemics like COVID. Once they strike, we should be able to access this money without waiting for donation, without waiting for charity money. And we can do it if we make a contribution as a country, as developing countries, to this fund. Thank you so much.
UBC, inspiring Uganda.